Hello, my name is Jose. I'm gonna be your nurse today. Can I please confirm your full name and date of birth?
Brandon White, 5/24/1995.
Thank you, Mr. Brandon. Before starting, I'm gonna make sure that the whole area is safe for the patient and the whole area is safe. And also I'm gonna close the recording so we can have some privacy. Now I'm gonna do some hygiene. Washing my hands. Okay, Mr. Brandon. Just to explain, I'm gonna be doing a physical assessment on you today, head to toe, and also I'm gonna be checking your vital signs. Is this okay?
Yes, sir.
Okay, perfect. So the first thing that I'm gonna do is I'm gonna raise the bed. Okay. All right, Mr. Brandon. Is it okay if I start taking your vitals?
Yeah, yes, sir, absolutely.
Perfect. All right, I'm gonna start with the temperature. It's gonna be, I'm gonna do your axillary reading. Okay.
Excellent, sound, yes, sir.
So temperature of the patient is 98.6
Excellent, thank
Fahrenheit degrees. Now I'm gonna check blood pressure. I'm gonna check brachial pulse. Okay, Mr. Brandon, your blood pressure today is 110/80 millimeters of mercury. What's your normal blood pressure?
118/76.
Okay, so blood pressure is under normal range. And now I'm gonna be checking your pulse oximeter. While I'm doing this, I'm also checking the fingers, and I'm checking the nails and inspecting them, and they look clean, round, normal. Also, I'm gonna be checking the capillary refill. Capillary refill under 3 seconds, which is under normal range. Oximeter is reading 98% room air, which is also under normal range. Now I'm gonna be checking the pulse, the radial pulse. I'm gonna place it on the chest of the patient so I can also check the respiration for a full minute. And after a full minute, I have a reading of 16 respirations per minute and 70 beats per minute for the pulse. Okay, Mr. Brandon, I just have a couple questions for you. Do you have any allergies?
I do not.
Do you take any medications?
I do not.
Do you have any diet restrictions?
I do not.
Okay, perfect. And do you have any pain today?
I do not.
Perfect. Okay, so if the patient will have any pain today, I will be using old cards rule. Okay, Mr. Brandon, can you also tell me who is the president of the United States?
Joe Biden.
Do you know where you're at right now?
Tampa General Hospital.
Perfect. And do you know what date of the week is and maybe at what time?
Wednesday. I'm gonna shoot for like maybe 7 to 10.
Okay, so in this case, patient is alert and oriented ×3 in time, space, and person. Also, I'm looking at the general appearance of the patient, and he looks relaxed, calm, no signs of distress. So I'm gonna start doing the physical assessment. First, I'm gonna be starting inspecting the head, and I'm looking at the hair. I'm looking to see if I have any lesions. I don't see any lesions, no bruises. Head is symmetrical. Now I'm gonna be checking the ears. Do you use any hearing devices?
I do not, sir.
Okay, perfect. So I'm gonna be checking both ears, and I do not see any kind of discharge. They both look symmetrical. Perfect. Okay, so I'm gonna be checking now the eyes of the patient. So I'm gonna use my pen light to check for the pupils. Okay, sir, can you look at my nose? And can you follow my pen light?
Yes, sir.
Okay, so pupils are equal, round, reactive to light, and accommodations. Okay, so now I'm gonna go down to the nose, and I'm gonna make sure it's in the midline. So the patient nose is midline, and can you look up a little bit? And the mucous are moist, and I don't see any kind of discharge, no lesions. Can you smile for me? A smile is symmetrical, and also can you open your mouth? And the tone of the patient looks pink, moist, and I don't see any kind of indications of infections or any other problems. All right, so now I'm gonna go down to the neck, and I'm gonna be checking the carotid pulse on each side, one by one. Okay, that carotid pulse on the right side is strong and is regular, and same on the left side, so that's good. And I'm making sure that the trachea is located in the midline, which is good. So now I'm gonna go down to the chest, and I'm gonna start doing your respiratory assessment and cardiovascular assessment. Okay?
Yes, sir.
For the respiratory assessment, I'm gonna make sure that the patient is not using the respiratory accessory muscles, which is not happening in this case. And I'm gonna auscultate now using a zigzag movement. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Respiratory sounds are normal and regular, which is perfect. So can you, I'm gonna sit you up a little bit. You can stand up a little bit so I can check the back. And I'm gonna repeat the same movement. Take a deep breath. Take a deep breath. Okay, perfect. So the respiratory sounds are normal and regular. So now I'm gonna be auscultating the cardiovascular sounds. I'm gonna start with the aortic sound, which is located in the right sternum border of the and second intercostal space. The pulmonic, which is located in the second intercostal space, left sternum border. The Ernst point, which is located in the third intercostal space, left sternum border. Now tricuspid, which is in the left sternum border, fourth intercostal space. And now the mitral, which is on the left sternal border, on the fifth intercostal space. And all of the heart sounds are good and regular. And I did not auscultate any irregular sounds, which is good. Now I'm gonna be going to the abdomen, so I'm gonna have the patient laying down. Okay, Mr. Randall, so we're gonna be laying down.
Yes, sir.
Have you had any bowel movements?
Yes.
When was the last time?
A couple hours ago.
Okay, good. any kind of nausea, vomiting?
No, sir.
Okay, perfect. So the first thing is I'm gonna keep the privacy of the patient. I'm gonna leave up the t-shirt. So I'm gonna pretend I'm doing that, and I'm gonna be inspecting the abdomen to see if I see any distension, any abnormal coloration. I do not see any abnormal coloration. Abdomen looks good, no distension, no swelling. Okay, perfect. So I'm gonna start auscultating the abdomen, starting on the right lower quadrant. And now moving up to the right upper quadrant. Now left upper quadrant. And now lower right quadrant. And all vowel sounds are present, which is good. Okay, Mr. Brandon, I'm gonna move the head a little bit, but before that, I'm also gonna palpate, and you let me know if you have any pain. Okay? Just a very superficial palpation. Any signs of pain?
No, sir.
Okay, perfect. So we don't have any pain. So I'm gonna sit you up a little bit again, so you're comfortable. In this case, the patient is not using a urine catheter, but if that will be the case, I will make sure that I do not see any kind of infection, signs of infections using the catheter. Are you urinating well? Do you have any problems?
I do not.
No pain at all?
No, sir.
Nothing? Okay, perfect. So at this time now I'm gonna go and check upper and lower extremities. With the upper extremities, I'm gonna make sure I have inspecting first and see a good coloration, which is I see a good coloration. Do not see any kind of lesions, no swelling. The patient's skin feels warm and good, nice and warm. So now I'm gonna be checking both radial pulses to make sure they're regular and symmetrical, which they are. That's really good. And at this time, I'm gonna check for the skin elasticity, and patient skin is elastic. So also, sir, if you can push my hands at the same time, good. And if you can squeeze my fingers, perfect. Okay. So now I'm gonna go to the lower extremities, and I'm gonna do the same thing. I'm gonna be checking for swelling, any kind of lesion. I do not see any lesions, no bruises, nothing, no edema. And I'm gonna be checking both pedalis dorsalis pulses. They're both present, regular, and equal. Okay, good. Now with your legs, can you push? Okay, perfect. All right. So to conclude, I'm just gonna ask the patient if he has any other concerns. And Mr. Brandon, do you have any other concerns today?
I do not.
No? Do you feel comfortable?
Yes, sir.
Okay, so now I'm gonna lower the bed, and I'm gonna make sure that I'm lifting the bed trails so the patient doesn't fall. Okay, sir, so here's the cold button in case that you need anything, okay?
Yes, sir.
And I'm gonna wash my hands again before I leave. Thank you so much and have a nice day.
Thanks. Thank you, Jose.